Welcome to our channel, Hashmi Clinics.
Welcome, everyone. Today, we're going to do a deep dive into APHIS Chenopodii Glauci. Now, this is one of those insect remedies that often flies under the radar, but its incredibly precise and, frankly, unusual symptom picture can be the key to unlocking some really tough cases. So let's explore the keynotes that make this remedy so indispensable.
All right, so here's our plan. We're going to start with the core essence of the remedy, where it comes from and why that's so important. Then we'll build out the mental and general picture, zero in on those weird and wonderful guiding symptoms, and look at the modalities. And finally, we'll wrap up by comparing it to some other remedies to make sure we're prescribing with real precision. Okay, first up, the core essence. To really get APHIS, you can't just think about the insect. You have to look at its entire ecosystem. Its whole personality, its whole therapeutic character is shaped by this incredibly close relationship it has with its host plant, Chenopodium. You just can't separate the two. And this right here is the foundational principle, the key. Aphids lives on Chenopodium glaucum, and that plant is well known for causing colic and major digestive upset. So it's no surprise that the remedy proving is just steeped in these themes. You've got colic, you've got rumbling, and you have this very characteristic ineffectual urging that, as we'll see, shows up all over the place. Now, check this out. This has got to be one of the most peculiar and descriptive mental symptoms in our entire Materia Medica. When a patient says this, your ears should perk up. They're not describing a pain, they're describing a sensation of movement, of their brain literally being swashed hither and thither. What a strange and vivid feeling. This is a massive, massive keynote for APHIS. So if you need to boil this remedy down to a single sentence you can carry in your head, this is it. This is the clinical cheat sheet. You've got this bizarre toothache that gets better from sweating, this super specific left-sided back pain, and this colic that comes with this double whammy of urging. That's the core trio, the tripod of symptoms you have to remember. Okay, so let's zoom out a bit and look at the whole person. We've got these sharp particulars, but how do they fit into the bigger constitutional picture? Let's look at the mental state and the key physical generals. So on the mental side, it's not a massive sprawling picture like some of our big polycrests, but what is there is very clear. There's this distinct sadness that often goes hand in hand with their physical symptoms, especially the headache. They can't sleep at night. And here's another peculiar little clue. Their dream life has this very specific amorous or lascivious quality. It's a great little confirmatory symptom. Now, looking at the physical generals, a couple of things really jump out. First, those food aversions are really specific: meat and wheaten bread. But what's even more of a signpost is the chill. This isn't just, oh, I feel a bit cold. No, it's a distinct shuddering that they feel in their back, and it often shows up right as a cold is coming on. And now we get to the really good stuff, the guiding symptoms. The strange, rare, and peculiar things that make you say, aha, I know what this is. These are the keynotes that really define APHIS and make it unmistakable. All right, everybody listen up. If you remember one single thing from this whole talk, just one thing, let it be this: the absolutely characteristic APHIS toothache. This is, without a doubt, the grand keynote of the remedy. And it's the modality here that's just wow. It's totally unique. So imagine this. Your patient has a violent, tearing toothache, maybe shooting up to their ear. It gets so much worse from the warmth of the bed at night. And the only thing that gives them relief is when they break out into a warm sweat all over their body. It's bizarre, it's paradoxical, and it is absolutely pathognomonic for APHIS. No other remedy has that. Okay, here's another incredibly powerful confirmatory symptom. Think of this one as a GPS coordinate that points you directly to the remedy. It's a very specific pain in the back. And the precision here is everything. It's not just shoulder pain. It is specifically at the lower inner angle of the left scapula. You've got to nail this location, because we all know its closest cousin, right? Chelidonium. That's famously the right scapula. APHIS is left. It's that simple, but it's absolutely critical for getting the prescription right. APHIS also gives us this really characteristic cluster of symptoms that you'll see across the digestive and the urinary systems. This combination is another one of those key identifiers that makes the remedy stand out. So you see this recurring theme, right? Ineffectual urging. The patient constantly feels like they need to go, but nothing much happens. It's fruitless. And the key is that it happens for both stool and urine. That combo is a huge clue. Then you add in this very strange, very specific, voluptuous sensation. I mean, it doesn't get much more peculiar than that.
And to top it all off, their secretions, nasal mucus, urine, tend to be frothy. It paints a very, very distinctive picture. Okay, so let's put all these symptoms into context now by taking a quick look at the patient's modalities. You know, what makes them better and what makes them worse. As you can see, the modalities are few, but they're incredibly precise. The big aggravations are motion for the headache, being in a warm bed at night for that terrible toothache, and cold, damp air for a cough. And then, standing all by itself, is that one single defining amelioration. The toothache gets better from a general warm sweat. That's the whole story in a nutshell. So, clinically, when should you be thinking about this? Well, it's for these common acute situations. A patient comes in with colic, a bad cold, diarrhea, a headache. Your job is to check for the APHIS keynotes. Ask about that chilliness in the back. Ask about the scapular pain. And you absolutely have to ask about that unique toothache. That's how you'll spot it. All right, to prescribe this remedy confidently, we have to be really clear on how to tell it apart from a few other remedies that it can sometimes look like on the surface. Now, this is absolutely crucial for your practice, so pay close attention. Look at the difference with chamomilla. Yes, both have sweat, but with chamomilla, the whole patient feels better from sweating. With APHIS, it's only the toothache. That's a huge distinction. The comparison with chelidonium is easy, right? Chelidonium is right scapula, APHIS is left. And then, Nux vomica. We all know it's the king of ineffectual urging, but with Nux, it's almost always just rectal. APHIS has that unique combination of urging in both the rectum and the bladder. That's your tiebreaker. So, let's wrap this up with 5 key prescribing pearls to stick in your mind. Think of it as a rapid checklist. Number 1, a cold that starts with that chilliness up and down the back. 2, that double whammy of ineffectual urging for both stool and urine. 3, the left scapular pain is your big signpost. 4, that toothache relieved by sweat is pathognomonic. It's a dead giveaway. And 5, don't ever forget that peculiar voluptuous urinary symptom. If a patient has 2 or more of these, you have got to be thinking about APHIS. And I'll leave you with this final thought to chew on. Just think about it for a minute. A patient walks into your clinic complaining of severe pain under their left shoulder blade that runs into their chest. Where does your mind go first? Probably something cardiac, right? And that just highlights how incredibly important it is to have these precise, smaller remedies in our clinical toolkit. Knowing a Bacillus anthracenus can help us solve cases that might otherwise get misdiagnosed or, frankly, just never get resolved.
Professor Dr. Rifat Hashmi is a distinguished homeopathic physician, educator, and researcher with over 4 decades of clinical and teaching experience. He is widely respected for his deep command of Materia Medica, repertory, and constitutional prescribing, combined with a practical, patient-centered approach. Dr. Hashmi has dedicated his career to training generations of homeopathic doctors, blending classical principles with modern clinical insight. He is also known for his innovative work in digital homeopathy, developing educational content, clinical tools, and AI-assisted systems to enhance remedy selection and case analysis. With a strong commitment to ethical practice and lifelong learning, Professor Dr. Rifat Hashmi continues to guide, inspire, and elevate the standards of homeopathic education and patient care.